Nurses and midwives at the Northern Beaches Hospital have walked off the job amid an ongoing pay dispute with private health provider Healthscope. Miles Holbrook-Walk reports.
This strike action is going to last until 8 a.m. tomorrow. Essentially what we're seeing is hundreds of nurses and midwives walk off just the job here at Northern Beaches Hospital. That's despite the fact that Healthscope runs a dozen hospitals right across the state of New South Wales. However, it's just this one here that's undertaking strike action. However, it is regarding working conditions for all the workers covered by the Healthscope agreement. There's an interesting thing here at Northern Beaches Hospital which is quite unique, in that it is a privately administered hospital through Healthscope. However, it's a publicly funded one. It was built by the state government and then subcontracted out at the time of its initial establishment to ensure that health services could be provided by Healthscope. Now, nurses are saying that there are unreasonable expectations on the workforce and for quality patient care. They say that ratios are among their key demands here, wanting to see what has been agreed to in the public system now enacted here at the Northern Beaches Hospital.
We want 1-to-1 in resus, we want 1-to-2 in HDU, we want 1-to-3 in ED and 1-to-4 on the floor, which are safety standards that give us the best outcomes for our patients.
Are they the ratios in the public sector at the moment?
Well, they're the ratios that have been promised to the public sector. So the government has been very, very slow to roll them out, so no blinkers on there, but it's certainly what we want.
There's also demands around pay and conditions. The union wants to see a 15% one-off pay raise, as well as improvements to night shift and overnight penalty affordances. However, Healthscope says its current offer of 13.5% over 3 years is a competitive and fair one that they've described as market leading. As for overall impact on services, it may be the case that staffing is actually better than some days they typically see, with the private health provider anticipating this upcoming action and ensuring they say that all of their services will operate fully, including elective surgeries. Typically, when strike action like this does take place, a number of elective surgeries would be cancelled. However, Healthscope said in a statement that wouldn't be the case. And with the impasse between Healthscope and the union, it's scenes like these which have seen nurses take to the streets here, encouraging supporters to honk along as they beat their drums and make their demands. Well, they could be fixtures of the future as well. It could all end up being resolved at the Fair Work Commission. However, for the time being, the union says it wants negotiations to prevail. Whatever wiggle room they might have up their sleeve in terms of compromises on pay, for example, to get guarantees around staffing ratios, remain to be seen.